Namaste.
Namaskar.
Thought Habitat Speaks began with the In Conversation with series, where we interviewed authors and then we interviewed some business leaders for their comments on budget. And then we moved on to cover women achievers under our Accomplished Women series. And this series is continuing. It is continuing in a way that for the next 100 episodes, we have people ready to be published. And then we went on to Politics 360, under which we covered the political scenario in Tamil Nadu. And now we are moving on to a fresh series, that is Health Matters. 7th of April is observed as World Health Day. Well, this series is going to go even beyond 7th of April. We have a whole lot of medical professionals in India who have the technical finesse to cure the entire population, who really think beyond the commercial aspect. And our guest today is one such person. He is one of the senior most nephrologists the country has, and he has the pedigree of focusing on quality treatment for his patients. Let us all welcome Dr. Umesh Khanna, the Managing Director of Kidney Associates. And to tell a little further about Dr. Umesh Khanna, he, as we said, he is the Managing Director of Kidney Associates, and he is also an active part of other kidney organizations such as Amar Gandhi Foundations, Sapiens Foundation, Mumbai Nephrology Group, to name a few. And yes, as we said, he is that doctor who only believes in giving the best to his patients, whatever it takes. So without much ado, let us invite Dr. Umesh Khanna. Sir, thank you so much for joining with us today.
Thank you, and good afternoon to my listeners. It's my pleasure and a privilege to be talking to all of you all, especially on a subject which is close to my heart. And as you mentioned that you've been through politics, you've been through economics, and you have come to health. I thought COVID has said that we will leave aside economics and politics and talk only of health, and that health seems to be much more important than economics and politics combined together. Anyway, good
Absolutely, sir.
afternoon to all.
Absolutely. Yeah. So, sir, I'm jumping onto my questions.
Sure.
When it comes to kidney matters, there are a lot of myths and facts around. People are really confused which one to take and which one to miss. And thanks to all the YouTubers out there, even I'm also a YouTuber, that's a different issue. But again, we have YouTubers who abruptly publish certain comments, like they say that 5 tips to keep your kidney healthy, and do all this, your kidney will be healthy forever, you'll live a long life, etc. I've seen a lot of them. Yeah, and
Yeah.
I literally got confused. Then I thought that, okay, I'm not going to watch any of this anymore.
Yeah.
Yeah. So then the first myth which I saw was about having painkillers. So people say having certain painkillers is actually not good for your kidney. And however your medical condition is, don't even think of having this painkiller, people say. So what is your opinion on that, sir? Like, and also, would you like to name some of those painkillers?
Sure. Yeah. So I'm glad you talked about this 5 tips and 10 tips. I think the whole world is interested in very quick solutions. And unfortunately, health requires a lot of discipline, and there are no quick, easy solutions to it. It's a lifelong discipline. And as far as painkillers go, again, it's a very quick way of handling pain rather than doing certain things like physiotherapy, walking properly, sitting properly, yoga, things like that. So in the absence of that, the fast lifestyle has put a lot of strain on the back, the shoulders, the spine, and so on, which causes a lot of pain, even in people who are otherwise healthy. Painkillers are one of the Third most important cause of kidney disease, if you take diabetes, blood pressure as the first and second one. Unfortunately, painkillers haven't yet been recognized universally by the governments and do not carry the kind of warning which a cigarette smoke carries, or they don't show a skull on the tablet prescription, which tells you that it is as dangerous. Now, a couple of days painkillers in a given situation is fine, but when you write a prescription for 3-4 days, patients keep taking for a longer period because they get relieved of pain. Now, painkillers in special situations, especially for somebody who's got a weak kidney, for somebody who's got swelling, for somebody who has a heart disease, a liver disease. So those who do not have an absolutely healthy body, they are much worse than for a normal person. So there are painkillers which are called NSAIDs. Now I have started using some technical terms, non-steroidal anti-inflammatory drugs. These are the commonest ones. We know them by the common names of Combiflam, Brufen, Ibugesic, etc., etc. So these act by reducing the inflammation or swelling, and therefore they give immediate relief. We have also heard of diclofenac and Overeating and things like that. Taken over a longer period, they have a few side effects. One, if your blood pressure is well controlled, they can increase your blood pressure. Two, if you have no swelling, they can start causing swelling. Three, if your creatinine or kidney function is normal, over a longer period, it can lead to kidney dysfunction. But more importantly, those who have a heart disease, it can precipitate a heart failure. So there are certain things which even some of our family physicians do not consider it as very important enough to inform you. So patients who have heart disease, kidney disease, etc., they need to be very, very careful. After you do away with these kinds of painkillers, there are painkillers which act on the brain, the nerves, and soothe them, or what are called as, they are not narcotics, but they act in the brain and dull the pain nerves. So like tramadol and things like that. They cause a little constipation, stomach distension, etc., but are safe for the kidneys. And of course, commonest one which all of us take is what is called paracetamol or Dolo or Crocin and things like that, which are reasonably safe if taken in smaller quantities from the kidney angle. If taken in larger quantities, they affect the liver. So this is the story of painkillers. The best painkiller is the one which is not taken.
That's absolutely interesting, sir. And sir, now next to painkillers, I'm moving to salt and sodium intake. Yeah. So there is also, as you related painkillers to blood pressure, salt is also related to blood pressure and kidney function. I heard people saying that excessive salt in food on a daily basis is really going to affect your kidney, and like your kidney will get dysfunctional and you will have these issues. Sometimes, I know a friend of mine who really got freaked out and he came to me crying, I eat more salt, so does it mean my kidney goes dysfunctioning? And I really pitied that guy. So would you like to tell us
Right.
about that also?
Yes. So again, salt is a very favorite topic of mine. I've given many talks on salt and its effects. So salt, if you know, for thousands of years, never was used for food. It was more of a preservative. In fact, before the refrigerators came, it was salt only. And our grandmothers and others know that if you want to keep something for a longer period, you put a little more salt in it, whether it is pickles or whatever, and it gets preserved. Or even, it used to be used for making ice creams and things like that. Bahar lagate the ice to, kind of cool it down. So salt had different purposes. It was not for taste. Till somebody decided to add it as a condiment, and then our taste buds started getting used to it and we started eating salt. If you take chimpanzees, if you take the older tribes, they hardly consume salt and their blood pressure is 90/70, which is considered absolutely normal for them. If you feed chimpanzees with salty food, their blood pressure becomes 140/90. While if you compare it with the other chimpanzees, their BP is 90/70. So definitely salt has an important role to play as far as blood pressure is concerned. So salt can lead to increased blood pressure. It gets converted into water in the body, so it can lead to swelling. So those who have a heart disease, those who have a kidney disease, they will start getting swelling in the face, legs, etc. if they consume more salt. Blood pressure, heart disease, swelling, these are some of the common ones. Then some of the uncommon ones, like it can lead to stone formations and all. Salt causes a lot of thirst, and because of that, you consume a lot of water and has its own issues. Salt is good for taste, but not good for the body. It causes a lot of illnesses. The WHO recommends 5 grams of salt per day. Indians consume anywhere from 10 to 14 grams per day. The world consumes anywhere from 8 to 10 grams a day. It has been realized now, and therefore certain countries, especially the European ones, and UK is a leader in trying to control salt. And their movements of, there are a lot of NGOs who are working against salt, and they've started this movement against salt, with which slowly even these multinationals have started reducing the salt in the popcorns and in the potato chips and crispies and things like that. 10% they reduce over a couple of years. Today, they have a 30% reduction in the salt intake without anybody knowing about it, because they have reduced it slowly. And I think now the same movement has been started by my NGO. My friend, Dr. Ravichandran, is working in the South with Sapiens Health Foundation. I'm a trustee there. So we are all trying to work against salt. Salt could be hidden. We feel salt is always salty. But if you take cakes, pastries, etc., rich in salt. Noodles, extremely rich. So all the processed food, and I think we'll talk about it a little later, they are all full of salt. So some of these chips and all, the entire day's quota is over. Now, when you say 5 grams of salt, what you mean is 1 spoon. If you can't measure it, then ek chimti lene ka, 1 chimti, what do you call it? 1 chimti is 1 gram. So some of the patients who have kidney disease or heart disease, we say only 2 grams, 2 chimti per day. So you make saltless food and add these for the, it's called rationing of salt for them. So anyway, salt is something I can speak for hours together, but for today, this is enough, that we need to be learning how to find taste in food with less salt. And Indians have a huge amount of spices which can replace salt, including amchur and limbu and many of the others which can give a little khatta taste but can replace salt. I could go on and on. So you could ask me something else, otherwise we'll get lost.
In fact, my next question, as you said about processed food, it is again about salt. So what is your take on processed food, sir? As you said, like noodles is high in salt, and so we shouldn't be taking up much of noodles or any processed food. So like, how is this, the entire game of processed food connected with kidney dysfunctioning or kidney problems?
Correct. So as I said, that salt was always used as a preservative. So processed food, they generally have a little higher salt because it probably keeps the shelf life a little more or better. Processed foods are 2 main problems. They are salt and phosphorus. So for kidney disease, both are important. For other people, the phosphorus part is not a very great problem, but for kidney disease, phosphate accumulates, or kidney patients cannot excrete phosphorus. But salt is common to all processed foods. And therefore, when you have to read the label before you buy anything from the market, if it's processed. Unfortunately, so I went on one of the flights and, they serve that ready-made upma, you just put some hot water and the upma is made in and I was shocked to read the label and the amount of salt. My entire day's salt was there in that upma, which I ate. So as I said, that to preserve something like that or increase the shelf life, processed food contains a lot of salt. So salt and phosphates are the 2 important things in processed food. And of course, many of them do contain a very high amount of oil and calories, and they are unhealthy. So that is why they came across with the idea of having green vegetables or fresh fruits or fresh vegetables. And of course, in our country, we have the good fortune of preparing things at home much more, because we don't have always, we have help at hand. You can always make food at home. But abroad, the concept of processed food is much, much more than our country. It's soon catching up in metros, and we are also forced to eat a lot of processed food.
That's really interesting, sir. And sir, the next myth, or like so far, like whatever I told as myth, you did confirm that yes, it is true. And then
Yeah.
again, and yeah, again, the next thing is on overeating. Some people say
Yeah.
overeating too causes some kidney troubles, right? So, what's your take on that?
Okay. So overeating in people who are otherwise having a very sedentary life is all you've already done a couple of talks on economics. So it's economics of calories. I mean, how much goes in and how much you spend. And that's what it's not just a question of eating, how much you're spending also, and that will decide whether it's harmful or not. Overeating is basically going to lead to obesity, and obesity is the third, again, diabetes, blood pressure basically are caused by obesity or weight gain also. So obesity becomes a very important reason for kidney disease. It leads to high blood pressure, it leads to osteoarthritis, it leads to heart disease, and so on and so forth, including fatty liver, obstructive sleep apnea. So a lot of problems which obesity causes, which indirectly and directly affect the kidneys. There is now a huge, not just a chapter, but uh, understanding of how obesity is dangerous for the kidneys also. So overeating per se, no. If you are going to exercise and use all your calories, then eating is good if you eat the right stuff. If you eat the wrong stuff, as you mentioned, processed foods or high calorie stuff, and you're going to add on a lot of fat or chubby to the body, then it's bad. Secondly, some people have these food fads and they eat a lot of high proteins, excessively high proteins for building up muscles, and showing off those muscles, especially the youth who want to exercise and are given these excessive protein powders. Some of the protein powders contain creatinine and all. So these are the new, I won't say myths, but the food fads which are not very good for the kidney. So not everything which is supposedly natural is good. It has to be consumed in the right quantity and the right context. So overeating by itself is not going to cause kidney disease, but overeating will cause obesity, and obesity in turn will cause diabetes, blood pressure, and kidney disease. And of course, sedentary. Overeating with sedentary lifestyle is a problem. Eating per se, sensible eating is required. Yeah.
Yeah, that's interesting. And sir, the another thing which I've been reading across is sitting in one place for a long time does cause some kidney trouble. There does cause some harm to your kidney.
So we've
So
reached something which is a myth now. So this is what is definitely a myth.
that's really wonderful. But why is that happening, sir? Like, I mean, why would someone say like that? Sitting in one place for a long time and then you'll get kidney
Yeah.
problems?
Okay. So sitting in one place is what probably that person meant was being sedentary. That means you are a couch potato. If that couch is the place where you're sitting, um, so it's not the position and that is touching the kidney and harming the kidney. No, nothing of that sort. Sedentary life, if you call it as sitting in one place, then again, as I said, these are all lifestyle diseases. Most of the diseases, 60% of kidney diseases are due to diabetes, blood pressure, and obesity. And these are all lifestyle diseases. And therefore, instead of sitting in one position, it's like this: running is better than walking fast, which is better than walking slow, which is better than standing, which is better than sitting, which is better than sitting in one position. So this is the hierarchy of how much movement you must make, and obviously the position is not touching the kidney or damaging the kidney. The sedentary life is.
That's really wonderful, sir. And sir, one last question. So, according to you, what is that an average individual has to do to maintain proper functioning of the kidney?
Okay. So the other part which I probably forgot to mention in sitting in one position is, again, the back issues keep coming up. if you're not moving, running, walking, and sitting in only one position, you tend to slouch, and therefore, you are in a position which causes strain on the back, and that makes you eat a lot of painkillers. So indirectly, that will be affecting the kidney. What should an individual, again, that means you're asking those 5 tips to keep your kidneys healthy.
No, I
Right.
just want one tip. I just want one tip
Okay.
from you, which is really sensible in your terms.
Yes. So again, most important thing which the kidney loves is water. And water in a normal, healthy person, he can drink as much as his thirst permits, as much as he wants to take. But if you already have a kidney disease or a heart disease, then you have to restrict water intake, because then the swelling will come up. So kidneys, a healthy kidney will remove as much water as you drink. So that's not a problem. And water is good for flushing out some of the stones, crystals, toxins, and so on. So good urine output is ensured by water. So first thing is water intake. Second most important thing, which a common man should remember, is that the commonest cause of kidney disease is diabetes, blood pressure, obesity. So he must eat sensibly. He must lead a very balanced life in terms of not a sedentary one, but exercise for at least 30 minutes. No smoking. I forgot to tell you, smoking, even the kidneys do not like. It's not just the heart doesn't like. It's not that your neighbor doesn't like. The kidneys also doesn't like. So exercise, no smoking, eating sensibly, no putting on weight, and no painkillers. And I think you touched upon all the vital areas which the kidneys are sensitive to. Water part was remaining, which I wanted to touch at the end, that water is again good for a normal, healthy kidneys. Yeah. And of course, one last thing, sorry, you must get your kidneys checked up after the age of 45 if you have no issues, and earlier if you're a diabetic, blood pressure, etc. Kidney disease is a silent disease. It will not cause any symptoms till late stage in life. So if you're diabetic or having high blood pressure, or your family has a kidney patient, or you have a stone disease or something like that, then you must get an annual health checkup done. It's very simple, not very expensive, much less than a pizza which you eat out. And just a urine test and a blood creatinine will tell you whether you have a kidney disease or not. So with that note, I thought this is a good opportunity for me, and I must thank you for that, for giving me a chance to put out some of
I
my
must, in
thoughts.
fact, thank you for giving your time. I know, with your focus on quality treatments, you must be very busy, and still you managed to give us some time and give a lot of insights for the average individual out there. And we believe all the viewers who are watching this, they would definitely try to inculcate all these good habits and maintain a balanced kidney functioning forever.
Thank you so much. Prevention is what is very important for kidney disease. There is no treatment, and India cannot afford dialysis and transplant because our population is not as rich as the rest, and our government can cover up only a small part of the expenses. So prevention is very important, and such kind of programs which a person like you has encouraged us to talk about, really helpful. Thanks again.
Thank you so much. Thank you so much.
Thanks, Arvind.